And that is a key part of our work at the Maine Center as well, which is to make sure that the work we do is not just research and analysis in isolation, but ultimately is research and analysis that speaks to issues and experiences that Maine people are facing. Here today to speak about the report is James Myall, who is the MECEP policy analyst and author of this year's State of Working Maine 2021. Matt Schlobohm, who is a MECEP board member and is the executive director of the Maine AFL-CIO, and Dan DiPolito, who is MECEP's vice president for communications. Again, if you have any questions, please, we will certainly leave time for that at the end and encourage you to post them in the chat function. So without further ado, I'm going to turn it over to Dan, who will be moderating today's discussion. And again, just as always, thank you to those of you who are supporters of the Maine Center for Economic Policy. You help make this kind of research and analysis possible. And for those of you who follow our work and share it with others, please do so as often as you feel inclined to do. You can like us on Facebook, you can follow us on Twitter, and all our research and analysis is available at any time on our website, www.mecep.org. So Dan, take it away. Thank you.
Thank you, Garrett, and thank you so much to everyone for joining us today, this afternoon, to talk about the state of working Maine and the impacts of the COVID-19 pandemic on Maine's workforce. I'm really excited to be here today with James and Matt. Again, as Garrett said, my name is Dan DiPolito. I'm the Vice President of Communications at the Maine Center for Economic Policy. So today we're going to take a look at the state of working Maine, get some additional insights and perspectives. We'll look at some of the findings as well as some of the takeaways and recommendations, and then talk a little bit about action, next steps, right? Where do we go from here? What can we do? And what can the general public, not just legislators and policymakers, but what can anybody do to help ensure that all Maine workers and families have the opportunities and resources that they need to thrive? So let's jump in. I'm just going to share a screen here. And we can start with just talking about some of the key takeaways of the report, echoing a bit of what Garrett said. And I think, one of the most important pieces here is that there are lessons beyond the immediate public health threat and COVID exposed flaws in our economic system, right? So another way of looking at this is that a lot of these issues aren't anything new. It's just that the pandemic kind of brought them to light and escalated those issues. We're seeing a general undervaluing of work, especially for individuals who we refer to as essential, and a broad lack of worker power. We know that workers, in order to return to jobs, they must be able to do so in a manner where they can provide for themselves and their families. So additional supports are certainly needed there. And we know that new policies need to come into play that improve conditions and supports and provide opportunities to rebuild a fair economy. And we're going to today take a look at, as the report highlights, there are really just three big buckets, three different needs. And that will sort of be the anchor of our conversation. One of the top needs that the report finds and that we're recommending is that we need greater supports to protect frontline workers. That's number one. Number two is we need program improvements to adequately support workers. And number three is we need investments in childcare, equity, and reforms to workplace practices. So let's dive in to number one, greater supports to protect frontline workers. So the report finds that in general, Mainers who worked in person were 50% more likely to contract COVID than remote workers. And as of September, Black Mainers were more than twice as likely to have contracted the virus as white Mainers. So let's go a little bit deeper now, drill down and look at some of the findings here that help to support some of the needs that we're recommending for moving forward. One piece of research is that a substantial majority of Maine workers continue to work in person during the pandemic. James, can you talk a little bit about this finding?
Yeah, of course. Thanks, Dan, for running through the top line findings of the report and sort of introducing things as well. Yeah, I mean, I think so. One of the big takeaways from this, or one of the things we wanted to get at, was a sense of like, you know, who were remote workers and who were frontline workers during the pandemic. As you've already seen, sort of like the risks were very different depending on what kind of work you were doing. And I think for those of us, you know, like many of us at MECEP, honestly, and I expect a lot of folks who sort of interact with our work, and certainly a lot of people who work in, you know, journalism. I think there was a lot of framing of sort of the big rush to remote work, and I think that was a big change for a lot of folks who did that. But I think it's really worth bearing in mind the extent to which, like, most people actually continued working in person during the pandemic, and this was especially true for folks who are working in frontline service occupations. You know, obviously places like working in grocery stores. People weren't able to work remotely, and we have some more data sort of on particular sectors going forward. But the big piece is that, you know, it was very easy, I think, for some of us to think about sort of a switch to remote work, and that simply wasn't possible for a lot of people. And a lot of those people were more likely to be people of color, and women as well were more likely to be working in those occupations, and so that really affected their COVID risks as well.
And Matt, I'm sure this is something that you've seen. Anything to chime in with about this piece of information?
Yeah. Good afternoon, everyone. You know, we're a labor federation, the Maine AFL-CIO, of about 160 plus unions, and the vast majority of those workers in our unions went to work every single day of this pandemic in hospitals, in nursing homes, in shipyards, in paper mills, in warehouses, in grocery stores. And I think that experience is very, very profound, and it's led us to this moment we're in. And I just want to lift up the grief and exhaustion that I think is very close to the surface for hundreds of thousands of Mainers and millions of workers across this country. I can't name a major work site, the union work site, where there wasn't somebody who died from COVID, whether it's the state of Maine and Department of Transportation, whether it's Bath Iron Works, whether it's paper mills, whether it's nursing homes. A lot of people, and we've all experienced this in different ways, but a lot of people went to work wondering whether all their coworkers would show up the next day, and in some cases they didn't. And people found themselves in a lot of cases fighting tooth and nail to protect themselves in the workplace. And I think the moment we're living through right now is one where there's a real contestation over whether this new category of essential worker actually means anything. And I think workers feel like we showed up day in, day out. We continue to show up, right? Let's not miss that the highest rate of COVID hospitalization happened in the past week. But we showed up every single day and delivered public goods, and we deserve some respect. We deserve some dignity. We deserve some remuneration. We deserve a voice on the job. And so there's a real fight playing out right now in a whole host of ways that we can talk about whether that's just a linguistic phrase or whether it actually means anything in policy, in the workplace, in the power workers have, and how we treat people.
Absolutely. Yeah. And part of what you said earlier, Matt, is a good segue to next piece here, that in-person Maine workers were more likely to contract COVID. James,
yeah,
insight here.
Yeah, this was really important for us to sort of grapple with as a research question. Was kind of like, you know, I really wanted to get at the sense of like we heard a lot about sort of individual stories about workplace risk, and we had a lot of stories in the media over 2020 and early 2021 about sort of individual outbreaks of COVID, but we really felt like we should be able to get at a sense of like where people were most at risk for COVID and how much was work sort of related to that. And so we found essentially that work was a pretty big factor. I mean, we were able to compare three big groups of people using sort of data that was collected on Mainers specifically in the Census Bureau's Household Pulse Survey. We looked at retirees, remote workers, and people who worked at in-person jobs. And we found that while about one in 20 people who said they were retired had contracted COVID. That number rose to, there was twice as much for people who worked in person. 1 in 10 in-person workers contracted COVID over the period that we looked at. And the risk was about 50% lower for remote workers. So it was only about 7% of remote workers. So being able to work remotely wasn't possible for everyone. And in fact, most people were working in person. But for those of us who were able to work remotely, there was some real privilege to that in being able to avoid COVID risks. And I think we'll talk a little bit later in the next slide about sort of how there were some specific industries within that in-person work that were especially dangerous. But that big finding that just being able to work remotely was a big safety measure that wasn't available to everyone was really important.
Absolutely. Yeah. Let's go to the next piece here. Right. Just mentioned, James. So the characteristics of Maine workers in high risk industries. I want to talk a little bit about this, James, and then again, Matt, you have some reflections.
Yeah, so I mean, there are a number of studies that are done in different places across the country. None particularly that were Maine specific, but I think a lot of these studies found very consistent results no matter where they looked at. So everywhere from Washington to Utah to Pennsylvania, a number of places in California, Massachusetts, a number of places have tried to look at sort of from administrative records, kind of where COVID cases were occurring and what occupations people were in, if they either caught COVID or if they died from COVID. And they consistently come up with the same sort of groups of high-risk workplaces. And some of them are, and they're, in many ways, they're some of the things you might expect, places with a lot of contact with individuals. So everything from service jobs like restaurants and traveler accommodations, so hotels, obviously both big industries in Maine, nursing homes, which you would expect, I think, given what we know about a lot of the outbreaks there. But also places like food manufacturing plants, even grocery stores, which obviously you'll see a lot of traffic, and even places like agriculture, delivery drivers, and some warehouse workers as well. So a lot of these places and a lot of the things they have in common, I mentioned earlier that not all of them, but many of them are jobs where women make up a larger sector of the workforce. That's especially true in care occupations, but also in restaurants and hotels. And most of these tend to have a high proportion of people of color working in them in Maine and nationally. And those are like not coincidences. We know that because of a lot of barriers to entry to the workplace and sort of advancement in the labor market, we know that women and people of color often end up taking in more low-paid jobs, and then they tend to be valued less because the people working in them are sort of historically marginalized groups like that. And so we also found that, you know, these are jobs that, because they're lower paying, people are more likely to be living in poverty. And they also all share these characteristics that folks who are much less able to work remotely. In many cases, there are almost no remote workers in industries as well. So it's this sort of this collection of jobs which were high risk, both because they were had a lot of person-to-person interaction. There was little opportunity to work remote. But then there are also groups like women and people of color, low-income workers who are more likely to be in these groups, and that sort of helped to drive how disadvantaged these folks were during the pandemic as well.
Matt, what are your thoughts and reflections on this piece?
Yeah, I mean, I think the pandemic in so many ways is a mirror that we can hold up to ourselves. And one of the things it revealed in the clearest terms is just this grinding inequality that structures our economy. And it's an inequality of wealth, an inequality of income, inequality of opportunity, inequality of power. And that cuts deeply along lines of race and gender and immigration status and geography. And so, you know, if you look sector by sector, the risks obviously were not equal in this pandemic and the tools people had at their disposal. So if you look at the meatpacking industry, both in Maine and around the country, it's largely an industry of workers of color, largely an immigrant industry. There was zero OSHA enforcement, and there were incredibly dangerous working conditions before the pandemic, and then you add a pandemic on top of it. I think, you know, nursing homes are another crystal clear example. And I just, you know, we know that our economy has always been structured by race and gender and immigration status, and it just has been laid ever more bare for us to grapple with. And I think there's a lot of responses coming out in the public policy space, workers quitting in record numbers, workers organizing, workers demanding economic and racial justice. And so, I think there's a continuum here, and where we go, and a lot of the things the report lays out, is really, really important to grapple with in that holistic sense of what people went through, how the ways that did not cut evenly, and how we try to build a greater whole together.
Absolutely. Thanks for that, Matt. Let's move on to the next big need as recommended in the report. I'll also just remind folks, we do absolutely encourage, please chime into the chat with any questions at any time. You can throw them in, and we will get to them later on and try to get to as many questions as possible. And also, of course, we'll make it clear how to reach us for anything we're not able to get to. Right, State of Working Maine 2021 also underscores this need here for program improvements to adequately support workers. So the pandemic made it clear just how vulnerable many Maine workers were, even from before the pandemic. And the pandemic might have been unexpected, but looking at the overall conditions of things, at the overall landscape, much of the resulting fallout was not a surprise. And so one piece of a finding here, a piece of research, that out of work Mainers exceeded the official unemployment figures. So James, this is really pointing to a situation that was pretty dire.
Yeah, and I think sort of when we talk about like the need for supports and the need for and economic hardship, the need to ameliorate economic hardship, unemployment is sort of one of the biggest drivers of that in all recessions, and was true in the pandemic as well. So one of the things we wanted to do was sort of get behind sort of the headline unemployment rate. We've done that in other State of Working Maine reports. Folks may know that the unemployment rate only measures folks who are actively looking for work, which even in sort of a usual recession can be a tricky measurement, because they can be folks who have just given up looking for work because they haven't been able to find any, but they would really like to work if they felt like they had opportunities out there. But this was, really magnified several times during the pandemic. So there was a really, there was a really big difference between sort of, even with what seemed like very high unemployment rates, in April of 2020, when we had sort of the first wave of sort of lockdowns and forced closures of places, the headline unemployment rate in Maine rose to 11%, which was a rate we hadn't seen in years or decades. But if we actually looked at, if we had included in that number, not just people who had lost their jobs and were looking for new ones, obviously in April, all the folks were not doing that. They were waiting to go back to their old jobs. If we included the number of people who had either dropped out of the labor force completely because they'd lost their job and they were not going to look for a new one because of COVID, or a large number of people who were on an unpaid furlough from work, that unemployment rate would have been north of 25%, which is sort of a level that we saw around, that would have been Great Depression kind of levels of folks who are out of work. Obviously, those numbers sort of declined as places started to reopen. But even now, we're seeing that the celebrations about sort of a headline unemployment rate that's below 4%, which is sort of a little high, but closer to a normal level. Those don't adequately reflect the number of folks who are either still waiting to go back to a job that has still not at full staff. There's still some folks there. And then a number of people who aren't actively looking for work because they have something that's keeping them from working. And that could be sort of a COVID-related concern. Maybe they don't feel safe about it. They're in a high-risk group. Or it could be that they can't find childcare or other forms of care as well. So there are a number of things behind that. But it's really important for policymakers to take into account this undercount in the unemployment figures, and how there are actually a lot of folks who are potentially in need of work or in need of employment but aren't able to get it for other reasons.
Absolutely. Matt, what's your take?
Yeah, I mean, we did organizationally a lot of work helping laid off workers access unemployment insurance, gain benefits, try to re-enter the workforce. And I think UI, unemployment insurance, is a good laboratory to look at the programmatic shortcomings, despite heroic efforts by the states, and the places we need to both strengthen social insurance programs, social safety net programs, and really bring an equity lens to them. And I think, I mean, this data point does not surprise me at all. You know, I think the gendered division of labor, which obviously has been with us for a very long time, in terms of who does the bulk of child rearing, who does the bulk of unpaid work in the home, that was accentuated profoundly in this pandemic as lots of people, but disproportionately women, juggled childcare and work in just grueling, brutal, difficult ways. And in a state and country where we don't treat childcare as a public good, for a lot of folks, I mean, that meant 6 months, 12 months, 18 months, where it was virtually impossible, given that public education is our de facto childcare system in many cases, and it was not able to be continuous despite heroic efforts by teachers and school districts. You know, that meant people were dropping out of a labor market to meet their family's most basic needs. I think the other place where we see this pretty acutely right now, we've spent a lot of time talking to older workers. Everyone knows we're the oldest state in the country. Everyone knows the demographic challenges and the workforce challenges we had. There were a lot of older Mainers who had jobs, part-time jobs, and were pushed out in the pandemic. And now, despite these incredibly tight labor markets, are having an incredibly difficult time being rehired because people, you know, whether it's robots doing the initial analytics of applications, or whether it's just someone looking and says, oh, this person's 62 or they're 68 or they're 71, you know, we're not going to give them an interview. And those folks then drop out of a labor market that I would love for all those people to be retired, but I think we know full well that Maine people are pretty hardworking, and a lot of those folks sadly need to continue to be bringing in income in their later years.
Yeah, that's important perspective. Thank you for that, Matt. Let's look at the next piece here about low wage employment sectors seeing the biggest layoffs and the slowest recovery. Actually, Matt, do you want to kick this one off? Insights on this?
Sure. Yeah. I mean, we see this in a lot of recessions where the most, you know, the working poor, the working class, it takes the longest to recover. It was certainly true in the 2008 recession. I do think the level of government intervention here is something we should really lift up as a very positive response. And there's a lot of good in terms of public policy and mitigating the worst of this pandemic. And I think these numbers are a little bit complicated because one of the things that I do think is happening is that workers are putting the low wage economy on trial in a pretty profound way. You know, you saw 4.3 million quits in August, the highest number in decades. And a lot of those are concentrated in hospitality, in retail, in lower wage sectors of the economy, where workers are fundamentally saying, wow, we just went through a lot. I'm going to do some reckoning here about what I want out of my life, what I want out of my job. And I think there's a dimension of this where workers' expectations have fundamentally been raised in this moment. And there is a deep sense that I don't want to go back to that crappy job with a crappy schedule with that I can't support my family on, and I'm going to take a little bit longer and try and find a better path here. So, you know, that I think is just an important dimension for us to explore in these numbers, and in particular sectors of the economy, about how we transform them and make them sustainable for workers in our communities for the long term.
Absolutely. James, any insights for low
Yeah,
wage sectors.
I think Matt summed it up pretty nicely. I mean, I think it does reinforce the way in which sort of like significant federal and state government aid was really important for low-income workers when many of them were laid off. I do think sort of it is interesting to think about what's happening now and how maybe some of that is driven by folks not wanting to return to some of these sectors for low wages, especially. I think we're definitely seeing we're seeing some wage gains and sort of that in sectors like hospitality and tourism in Maine, but I think we're also seeing that there's a real divergence, at least anecdotally, from the stories you see from businesses that are being able to rehire people. Those are the businesses that are offering higher wages and benefits, but also things like more flexible schedules or at least schedules that are driven by employees and not by employers, not asking people to come in on last-minute shifts. And I think also, in the restaurant industry, there's a real reconsideration of sort of the model of relying on tips so much for wages, and rather than being a supplement to wages, tips often, unfortunately, being a necessity for folks. And so there's, in the current environment and during the pandemic, the tipping system really called into question a little bit as well. But I think there's a lot going on in sort of this reevaluation of low wage work. And as Matt said, it's certainly going to require a reconsideration by employers about how they treat their workers, I think.
Absolutely. Let's move on to the next piece here, another finding. And I do see some questions coming into the chat. That's wonderful. Please keep them coming and we'll make sure to get to them. Right, despite the expanded safety net, economic hardship persisted for some Mainers, and Matt, said that, right, there were a lot of good things that happened here. And yet, certainly we know that more could be done. James, any insight on this piece?
Yeah, I mean, I think so. This is, again, it's going to be kind of a complicated story to tell because I think it's certainly the case, and there's lots of evidence, including sort of some of the numbers from something called the Supplemental Poverty Measure that the Census Bureau releases every year that showed that the amount of government aid that was given was really helpful for a lot of folks, and a lot more people would have been suffering a lot harder if we hadn't had things like the expanded UI program, the economic relief payments, stimulus checks, and then other things like expansions to the food assistance program and things like that. Those all did really make a big difference for a lot of folks, but at the same time, we see that hardship did persist for others as well. So it's a story both of sort of a success to the extent that we were able to help a lot of folks and ameliorate hardship for them, but also the way that a lot of folks still suffered even with that. So, I mean, the theme across sort of all the different groups that we looked at, again, we use the Census Bureau's sort of bi-weekly household pulse survey for this. And we looked at whether people reported having trouble, just general trouble with usual household expenses. So that could include food, utilities, things like that. Whether they were behind on their rent or mortgage, and then whether they reported sometimes or often not having enough to eat. And what we found is that, the levels of these were consistently higher. Consistently people with children found it harder to make ends meet, which is something we see in general in sort of poverty data as well. Having children is often, it comes with a lot of economic, requirements and a burden for some folks, and then also people of color who are more likely to be working in low-income jobs also find themselves much more likely to be in this position. So, in one sense, this emphasizes again sort of the racial inequities and just the disparate levels of hardship for some folks, and the need to focus on some of these groups. Someone asked about the time frame for this slide. This data here runs between May 2020 and March 2021. So this is over a long period of the pandemic. And we do see that sort of periods of fiscal relief really help, but some of those were also short-term impacts. So after the CARES Act passed, for example, and some of the economic payments went out to people that really helped. But then that effect faded. We have seen successes for people with children after the payment of the child tax credit, and that emphasizes sort of the need for that to continue as well. But it reinforces the fact that we need to focus on groups like people with children, people of color, and folks who are being left behind or not getting enough financial support.
What are your thoughts on this, Matt?
Yeah, I mean, I think, we saw this quite acutely. I mean, spending a lot of time talking to laid off workers, there were lots of folks on the edge or over the edge, people living in cars, people struggling to make ends meet, people selling plasma to pay bills. And I think, again, this mirror of inequality and the way in which the pandemic turbocharged existing inequality. And if you look at the housing market as one indicator, I think like the economic hardships take lots of different forms, and they impact, folks working full time in certain kinds of ways. They impact poor people in other ways, but there is a real sense of squeeze and hardship. And so like housing prices, rent prices, as one dimension of this, where those just creep up and up and up, and we see more people buying second and third homes in Maine. And if you try to work anywhere within 30 miles of the coast, like all these dynamics were very real and long standing in Maine pre-pandemic, and then they were just turbocharged and exacerbated in a number of ways. And then, this continues right there. We talk to workers pretty regularly right now who are being forced to quarantine with no paid leave, and end up, not having income for that time period. And again, I think like we can't overstate the childcare dimensions of all of this, and both the cost, the lack of availability, and the way that causes deep economic hardship and discomfort when you either can't get childcare or when you're paying a pretty hefty chunk of your overall income for childcare costs.
Absolutely. And we will get to childcare in just a moment. And thanks to those who shared some questions. There's a question about, will we share contact information at the end? We will absolutely do that. And let's go to the next and final section here, and or almost final section, and definitely want to leave time for questions. I'll go back to our slides here. So, right, the number 3 kind of big need that the report is underscoring is investments in childcare, equity, and reforms to workplace practices. So laws that improve working conditions and programs that remove barriers to work are necessary for workers to return the jobs that ensure they can provide for themselves and for their families, and so they can be supported now and into the future. It's really, really important. So a finding here is about unemployment claims data suggesting that women were consistently more likely to be out of work during the pandemic and recovery. James, you want to kick us off with some insight here?
Yeah, and so I think, we've already touched on this a little bit, but I think that speaks to a couple of pieces. So obviously it talks to sort of like the way in which women were disadvantaged by sort of the pandemic recession and continue to be finding it harder to get back into work. This is drawn from unemployment insurance data, so it's based on women who were working before the pandemic. And I think there are a couple of things behind that. We've already talked a little bit about sort of like the way in which sort of the historic unfairness in which sort of caregiving burdens are often placed on women in our society. And so whether that's caring for children or caring for other family members, that still unfortunately tends to fall disproportionately on women, and that work gets put on them. So I think there's some of this where sort of, especially where there were school closures or kids working remotely, people with school age kids, it was often the women in families who ended up taking care of that. But we also see that sort of as we're coming into what should be more of the recovery phase, we're finding that women are still at a disadvantage, again, for some of those caregiving reasons. And we found that sort of childcare is a big reason for folks not being able to work. When we look at some of the data in August, about 25,000 Mainers were unable to work and said they couldn't work because they didn't have childcare. Maybe their childcare center had closed, or they'd taken their kid out of care during the pandemic, and now they can't get back in again because most care centers in Maine have huge waiting lists, or there are new needs that are coming up that they didn't have before. For whatever reason, about 25,000 people said they couldn't work for childcare reasons, and about 22,000 of those were women. So it's way disproportionately falling on women, the needs for childcare. And so that points to a real need to expand childcare and access to that. And then the other piece that I think is that we've also touched on that is behind some of this pattern is the way in which women were more likely to be in these high risk, low benefit jobs, the frontline industries that we sort of call essential workers, but aren't necessarily paying at that rate. And so there's an irony in that women are working more likely to work in a lot of these places. But at the same time, these are also some of the places that have the most unpredictable schedules, the biggest risk for, will make it harder for people to balance care needs as well. So I think that's also adding an extra burden on women during the recovery as well.
What do you think about this, Matt?
I think James covered that quite well. I think the point in the chat someone made, about absolutely. I mean, this is about the whole care spectrum, certainly about childcare, but also family elder care in the oldest state in the country, and hopefully we can all make some progress there if we can drag the Build Back Better bill across the finish line. I think if we look at this in specific sectors, like, restaurants, hospitality, again, like a big part of Maine's economy, disproportionately women, and precarious work in many ways before the pandemic, deeply exacerbated. And, like those trend lines have continued. And I think it's, again, like in this last chapter of this conversation, kind of like, how do we build in structural solutions that take race and gender and immigration and the ways in which the economy was structured going into this pandemic, the ways it's been exacerbated during it, and come out the other side with something better, which is kind of what I hope we can all explore together and move towards.
Absolutely. It's huge. We can do it. Let's go to one of the last slides. Maybe James, if you want to touch on this just briefly, because I want to be sure we have time for the questions. That even with higher rates of claim denial, people of color experience higher rates of unemployment claims, more prolonged recovery than white Mainers.
Yeah, so I mean, there's a couple of things here. I think so one of the pieces is just sort of as with women, we're seeing people of color, especially Black Mainers from Indigenous backgrounds, finding it harder to get back to work. Some of that overlaps with those childcare needs. People of color in Maine are more likely to be younger and have children, but a lot of it sort of reflects historic discrimination, and there's a lot of research to show that with something like a 6-month gap on their resume, Black workers are much more likely to be rejected than white workers. So there's sort of some inbuilt discrimination that sometimes employers don't even realize there. So there's still work to be done there, and it's important to recognize that a full recovery means making sure that Black, Indigenous, and other people of color in Maine are also at full employment, that we don't just take our foot off the gas when the white population is back to full employment, which is historically more what's happened. And I think it also the chart speaks to the fact that we also looked into data about who was able to get unemployment insurance, and only about 1 in 8 Mainers who applied for unemployment insurance, about 15% applied and didn't receive it. Some of those may not have been eligible, and others may just have given up on the system because it was so unusable. But that number was much higher. It was about a third of Mainers of color who applied didn't get it. And again, some of that may speak to extra barriers that some of those folks have in terms of accessing, being able to access the system, having the time to navigate the computer system, and also for a subset of some of those Mainers of color, some language barriers and things as well. So there are a few things going on here, but it really emphasizes the need to make sure systems and the economy in general works for everyone.
Absolutely. Let's move on to recommendations. So we're not going to go through all the recommendations, but James, you want to touch on just a few of these, just give a very broad level, and then I'd love to hear from Matt as well about any further recommendations, in particular for people in the workforce. And James, if you want to maybe mention a piece or two of upcoming legislation, that would be great.
Yeah, I mean, the report sort of mentions a few different recommendations and they fall into a few different groups. So some of them are things that we've been working on for a while and are pieces that are especially becoming even more important due to the pandemic, because a lot of the trends we saw during the pandemic are also sort of just extensions of trends we'd seen before. So, you know, these include everything from increasing power for people in the workplace by facilitating the fair formation of unions and fair union elections. They include new programs like paid family and medical leave. Maine has a commission that's looking at that right now. And it includes sort of fixes to additional laws. So, you know, expanding the scope of our paid time off law. So it includes all workers, making sure there aren't retaliation from employers for using that, and expanding eligibility to people of color for programs like the Medicaid program, which currently doesn't cover everyone if their immigration status is in question. And things like that as well. So there's a whole bunch of things, and there's also, in addition to state programs, I think it's also important to remember that we're also working with federal bills that have been passed, the infrastructure bill, and potentially the Build Back Better plan as well, if that gets passed, that are going to require a lot of action at the state level to implement those as well. So we're going to need to see the legislature and the executive branch build out things like a childcare system, internet connectivity, things like that, to build on what's been passed at the federal level.
Matt, what would you add on to this?
You know, I think we're in a pretty interesting moment where we have the tightest labor markets in many ways that we've seen in decades, and workers for the first time in a long time have greater bargaining power. We mentioned this quits number. I mean, quits are one of the best measurements of worker confidence that they can get another decent job. And so, you know, workers are organizing in increased numbers. I mean, there's no way to solve these problems. These are problems of power fundamentally, and there's no way to solve these problems in our economy if workers don't permanently have more power, and if there's not a countervailing force to the power of corporations and the extremely wealthy in this country. And so, you know, you're seeing workers in Maine organizing in increased numbers, whether it's 2,000 nurses at Maine Medical Center, a wall-to-wall union at Bates College that's organizing right now, healthcare workers and others. And you're also seeing workers striking in record numbers for, you know, in the last couple decades in the private sector right now, and winning really good contracts. And so, you know, both the policy landscape that has really shifted, where bigger ideas are on the table, and the workplace landscape where unions are at an all-time high in terms of popularity and public support, and workers are really connecting the dots about transforming their working conditions. Like that, in some ways, it feels like we're on a bit of a knife's edge about whether we bury 4 decades of neoliberalism and trickle-down economics and move into a different era, or whether this progress is much more fleeting and you know, you see reactionary politics all over the country and dividing all over the world, and divide and conquer politics. And so I do think how we proceed out of this is incredibly important, and there's no shortcut there's no shortcut without workers having more power and organization in the workplace.
Thank you, Matt. Well, we're at the time for answering some questions. We have a number of questions, and they're starting to really roll in now. Again, if we don't get to all of them, by all means, please reach out and we can take a lot of them offline. One of the first ones was more specifically about data about aggregating by gender that may have been addressed. The question is, did you also aggregate the data by gender? If so, did you see any differences? Guess that would be for James.
Yeah, I mean, I think we touched on some of that already. I think,
yeah,
in terms of like the number of folks who are you know, out of work. I think trying to get at some of the information about you know, whether people were working remotely or working from home. There were some different trends there that were harder to pass out. I think partly because, you know, although more of the care responsibility, whether that's care for children or older folks or themselves, like falls on women. I think a number of women in Maine also found themselves just stuck in places where they couldn't take that time off, or they couldn't work remotely. So there were sort of some like countervailing forces there for those people. But yeah, we at least attempted to try and disaggregate by gender where we could for most of this data.
And I think we touched this one a little bit. Is age a factor in the data related to unemployment? This person says, my area of Maine has a mismatch between the available jobs and the people available to fill them. We are missing the 22 to 55-year-olds here. Any thoughts, James or Matt?
I think I would need to reiterate that I think that age discrimination for older folks is really a thing, and there is a big divergence in terms of sort of, one of the things that we found in the pandemic in terms of like, this was a factor in vaccine rollout as well, in which sort of like certain industries like hospitality really rely on much younger workers. And so, when those folks were put at the back of the queue for vaccine rollouts, that was kind of a concern. But we're also potentially seeing, some of those dynamics play out in terms of if different age groups are having different responses to the pandemic. That's almost certainly affecting some of these sectors more than others because of the way their workforces are composed.
For sure. A question here, which about research including childcare workers and their experiences in the workplace. Of course, the report touches on that, specifically asking about wages and working conditions. We do also have additional information at MECEP.org in some of the blog articles. So I think that one might be covered. Anything to add?
I think the only thing I'd emphasize is that I think it's definitely something that's really been highlighted. That's why childcare workers are particularly having trouble, childcare centers are having trouble finding workers. And I think that's one of the things that's really recognized in the federal bill. It really requires sort of paying a livable wage to childcare workers and getting them up to the wages of kindergarten teachers in the public school system to sort of really recognize them for the work that they're doing.
Matt, to do something.
If I could jump in on just on the earlier question about age and demographics of the workforce. I think as we all know, this is a very big issue in Maine and across the country. The upside of tight labor markets is that wages go up. The downside of tight labor markets is that for workers in those labor markets right now, short staffing was a huge problem pre-pandemic, and right now it is a incredibly acute problem. I talked to a unionized nursing home where a care assistant had just worked 35 days straight this week, and the wear and tear of that, and more workers, union and non, are being forced to work compulsory overtime, and there's just like we're frayed as a working class, and people are pretty exhausted, and both the difficulty of attracting and hiring workers, the difficulty of very particular problems in the pandemic has just meant that people are quote living in their workplaces in many cases, and it just exacts a tremendous toll on families. And this is the labor movement was really built and born around this idea of 8 hours for work, 8 hours for rest, 8 hours for what you will. And I think there is an emerging effort to bring that concept back into our life, that we don't exist to work, we work to live a decent life, and we need bread and we need roses too. And so I think these questions and the strategies, right? And immigration is part of this, and apprenticeship programs, and actually building really high quality career ladders, and all those things. And again, there's a whole equity lens to bring to it. But that piece is incredibly important, and we have to dig into it.
Absolutely. Thank you for that, Matt. Here's a question. Do you have any tools to suggest for calculating a, quote, a livable wage, unquote, for different regions in Maine?
Yeah, that's a good question. There are a couple of tools that are out there. One that I like most because it has some regional information in it is a tool from a team at MIT. It's called the MIT Living Wage Calculator, and they have both statewide numbers and county level numbers. One of the tricks is that, the numbers vary a little geographically within Maine, maybe not as much as some folks might think. But one of the big variations is there's a huge difference between single parent and two parent families, and also, whether folks have kids or not makes the biggest difference in sort of livable wages. But I think that tool is pretty helpful, and it sort of, I think, supports some of the idea that the statewide minimum wage should really be higher to account for closer to a livable wage for some folks, even if it won't meet it for everyone.
Great, thanks, James. Someone here says, I like the mention of unionization, though. Have you looked at how B Corps did during the pandemic? It seems like with the success of companies such as Provision Energy, that we should be focusing on the, quote, less controversial, unquote, form of corporate governance. I love unions, but we should look for wins where they come in mind.
Yeah, I think that was really interesting. Maybe Matt has a little more perspective on this too, but I think the B Corp, and that's like sort of like the more focused on community benefits rather than profits kind of form of corporation, I believe. That sort of like B Corp structure is interesting and has been getting more traction, but we're sort of limited in the amount of data that we have on it because there are still relatively few of them. But I think it's definitely a trend to be watching.
Yeah, I think it's a great question. And I would just say, I think like we need to pursue all of the above kinds of strategies, but I don't think that you can have a functioning democracy or you can solve inequality if you have 10% union density and 6% union density in the private sector. And there's a lot of public good benefits that unions do, from reducing racial animus in the workplace, building working class solidarity, reducing racial and wage gender gaps, and on and on and on. And I really think that if we want to build the power to truly tackle climate change on the pace we need to, or to build a functional healthcare system that treats healthcare as a right, workers just need to be much more deeply organized on scale. There have been very few other paths seen around the world to building stronger social democracies without a vibrant and robust labor movement. And there's a fundamental difference between workers actually having a meaningful voice and a say and being something closer to equals, and not leaving constitutional rights at the door when they walk into the workplace. And other policy measures which are harder to uphold. So I think absolutely we need strong public policy, corporate governance, co-governance, workers on boards. Yes, all of the above. We need employers to do the right thing for all the right reasons, and we need many more organized workers as a way to build the kind of power to create the kind of world we all deserve.
Thanks, Matt. We have 5 minutes left, and looks like I think 2 questions here, and I think that all the others were touched on in some way. But again, of course, please reach out to us if there's anything that we did not get to. Someone is saying, you mentioned that older workers are having a harder time re-entering the workforce. How does implicit and explicit ageism play a role in this, and how do you suggest both employers and the Department of Labor address this? Anybody?
I think it's definitely seems to be a factor. One piece of evidence is sort of a survey that the Maine Department of Labor did back in July for folks whose unemployment benefits were ending soon, and sort of saying what are the problems you're having getting back to work? And a large number of them said age discrimination. It's especially larger if you actually calculated it among those sort of the subset of older folks. So it definitely came up as things that people are encountering, and Matt, maybe you'll talk for that sort of coming up organically in the unemployment assistance group that the AFL-CIO has helped to run. I think one thing that I always point to is I think a lot of these laws that we have against age discrimination and any other form of discrimination don't mean a lot if they're not enforced properly. So I think it's really important to make sure that agencies like the Maine Human Rights Division and then the Department of Labor actually have the resources to go after this. A lot of our state agencies have been sort of starved of resources and manpower over the last sort of 10, 20 years. And they just really can't do active audits of companies or surprise inspections. And those are the kind of things that make companies actually adhere to the law. So I think that's a big part of it. And then I think there may be a role for sort of educating employers as well and sort of pointing to the problems with things like, as Matt mentioned, like the computer algorithms that automatically screen out people and often have some of these biases built into them. So I think there are things like that too.
Anything to add on that question or what James just said?
Yeah, I mean, I think explicit and implicit bias is very much a part of this. And, I think we're having something of a reckoning with at least like putting those concepts on the table and trying to grapple with them together. I don't know the answer, and I think it's a great question. I do think that like it's at least instructive to think about, we passed ban the box legislation or fair chance legislation in Maine this last legislative session, which in the initial application screening prohibits questions about immediate criminal background checks. So you don't just automatically exclude anybody who's justice involved at any point in their life, which obviously when that's done, it has huge racist implications. And so I think we have to evolve our hiring practices and our tools to think about how do we make the workforce more accessible for older workers, a particularly important question in Maine, and how do we, on all fronts, race, gender, immigration status, make it more equitable for workers across the board. So it's worth just like thinking about the fair chance legislation as one example where states that have done it have made real progress and not automatically shut the door on workers right out of the gate.
Absolutely. Thanks, Matt. We have 1 minute and one more question, which is this might be a bit too specific to quantify, but are you aware of any data of worker retention or attraction rates of businesses that pay higher wages / more benefits as opposed to more low wage / low benefits jobs? And maybe if you can answer that in 15 seconds.
It's a great question. Unfortunately, I haven't seen sort of specific data from Maine that we can get out for that. Lots of individual cases, but it would be great to be able to quantify that more.
Great. Well, with that, we do have some contact information here. It was put in the chat as well. I want to stick to time. Once again, please reach out if there's anything that we missed or you want more information. This report is big. There are a lot of big implications and recommendations, and we'll be coming back to it and talking about it a lot in the months and in the year to come. Big thanks to my colleague James Myall, policy analyst at Maine Center for Economic Policy, and to Matt Schlobohm, executive director, the Maine AFL-CIO and a board member at Maine Center for Economic Policy. And thank you to everyone for joining us. This has been recorded. We'll post it online, and stay tuned for more events and information coming your way, ways to get involved and to take action on these issues. Everyone has a great rest of the day. Thank you.